Welcome back to Wellness Wednesday. According to the American Stroke Association, a stroke happens to people in this country every 40 seconds. It is the leading cause of disability for adults, but it is also preventable and treatable. Welcome neurosurgeon Dr. Robert Ryan and his patient Annie Barron, a 30-year-old who suffered a hemorrhagic stroke last September. Thanks for being here. Annie, how are you doing?
Well,
you're in good health?
Place, yeah.
Okay, we're going to hear more later, and you're a baby. This happened to you as a baby. So, Dr. Ryan, what defines a stroke exactly?
So a stroke is a sudden event that happens, and it's related to the arteries in the brain. So about 80 to 85% of strokes are when an artery becomes blocked, usually from a clot. But about 15 to 20% of strokes are when the artery bursts open and has bleeding into the brain. Sometimes it's just from factors like high blood pressure, but sometimes it's because there's a malformation of the arteries, like an AVM, as in Annie's case, or sometimes a brain aneurysm.
Wow. What predisposes people, if anything, to this?
There's a few linked genetic factors, but many of them are just spontaneous. So with bleeding strokes, sometimes in many cases people don't know they have the lesion there, and then this just happens.
Yeah, why would you?
Yeah.
Right? So let's talk about AVM. Again, tell me what that is, the arteriovenous malformation.
Correct.
Woo,
Yeah.
got through
Yeah.
that.
Very
AVM.
good. Yeah.
All right, so what is that exactly?
So the arteries carry the blood up to the brain, so they're under high pressure. They have a thicker wall, and so they're the tubes carrying the blood up to the brain. They should go through progressively smaller channels so the blood has a chance to slow down and then go into the veins, which are softer. They have a thinner wall and then carry the blood back to the heart. In an AVM, the high pressure blood from the arteries goes directly into a tangle of the veins without those tiny little intervening vessels. And so that for that reason, they're weak and they can potentially burst and cause bleeding.
So that means that the blood is kind of rushed in there faster than that area can handle it? Is that
correct?
Basically
It's flowing through it at a high rate of speed. Sometimes the AVMs can present just because the high speed of the blood flow isn't letting enough oxygen into the brain, and it can irritate the brain, cause things like seizures or headaches. But the main problem that happens that's the most dangerous happens if those thin vessels burst and cause bleeding.
Okay. Annie, what did you experience? What happened and when did it happen?
It happened in the early afternoon. I was running errands with friends, and I had a migraine come on that was really fast and really intense. It went from 0 to the worst it could possibly be in a minute, if that.
Had you had a history of migraines?
Mm-hmm.
Okay.
And this migraine was different, and I told that to my friend and asked her if she would take me home. And that's really the last thing that I remember.
And
wow.
I think that's such a classic description and really important for people who have other headaches, that this headache was different, and then it came on in a split second, That's a classic sign for a bleeding type of stroke, a headache that reaches that maximum intensity in a very short period of time.
Okay.
So because headaches are so common, you don't...
Well, migraines are common. Do migraines predispose you to this at all, or is there no connection?
They don't tend to, not to stroke. Sometimes a migraine might relate to some of the reactivity in the blood vessels in the brain. Mostly they're not related to strokes. So really what we worry about is that sudden severe headache that can be a sign of bleeding in the brain.
Okay, good to know. So what happened then, even though you don't remember?
So my friend took me home, and my roommate found me.
Were you unconscious?
I was having a seizure.
Oh my gosh.
And she had just yelled a question in my room, and my response was a choking sound. So she pushed open my bedroom door to see what was going on, and I was having a seizure. So she called 911, and it was her finding me as fast as she did, and Dr. Ryan, of course,
Right.
that I am where I am today.
Because the response of treatment is super important. So
Yeah.
what kind of treatment did she receive?
So the first thing was to get to the emergency department, and at the time, because of having the seizure, she had an airway breathing tube placed, and then we get scans. We could see where the bleeding was, and then did extra tests to see where the malformation was. We shut down the blood flow into the malformation first through a minimally invasive procedure through the artery in the leg, so an embolization to slow down part of the blood flow. Then because of the size of the blood clot and the amount of the malformation that was left, we did an operation to remove the rest of the malformation and also the blood clot, which at the time was causing a lot of pressure on the brain.
Right. So what is her now? What does she have to do? Is it the baby aspirin treatment, or what does she do forward? Because she's only 30 years old.
Correct. Yeah. So the main thing going forward now is to make sure that there's no sign of the AVM trying to come back. We used to think.
Which would be what? What kind of sign?
Most of the time, just like leading into this, there are often not a lot of symptoms. So the imaging follow-up is important. We do ongoing angiogram tests and MRI scans to look to see if there's anything that looks worrisome. Many times, once the AVM's been removed, though, it's gone. So when we think of the other,
Let's make sure it's
and
gone.
Annie's been doing fantastic. So the other risk factors for ischemic type or blocked artery types of strokes, things like high blood pressure, smoking, those are things that can weaken the arteries. We still want to make sure you avoid those type of things. But cholesterol, diabetes, all those other things that predispose to clots aren't as much a factor in AVMs, but they're very important in the rest of stroke care.
So tell me about ages. Is it unusual for a 30-year-old to have a stroke, and is there any difference between men and women?
Bleeding strokes, especially from an AVM, tend to occur in younger people. So we see them even as young as children and teenagers, because many of these malformations are congenital, meaning you may be born with it or develop it early in life. So we often see in patients in their 30s and 40s these AVMs. Brain aneurysms we see a little later, 40s and 60s. AVMs tend to be equal between men and women. Aneurysms more common in women. So those are the main bleeding strokes.
Wow.
Yeah.
Well, do you feel completely recovered now?
Yeah, I have to take it slower still than I did before, but I feel like me again.
That's great.
Yeah.
I'm glad to hear that. And if there's any takeaway from this, if people have a sudden headache that's severe and different, please go straight to the ER, correct?
Correct.
All right, we'll be talking to you a little bit more on our health panel. I'm glad you're well.
Thank you.
For more on the Comprehensive Stroke Center at Virginia Mason or follow-up care at their neurology clinic, please check out their website that's there on the screen, or we'll have it on the website.